Hi, my name is Aldoris Bate, but people mostly call me T. I am a sickle cell awareness advocate and also a transition mentor, which means that I help transition the youth of sickle cell into the adult side of the hospital.
Okay. Hello, everyone. My name is Ewune, and I'm the founder of Minds for Melanin. Welcome to the second episode of Reflections in Color, Celebrating Journeys to Wellness. Today, I have with me Aldoris Bate, a sickle cell advocate, who is here to discuss her personal journey within wellness with sickle cell. Hi, T. Thank you so much for joining me today on Reflections in Color.
Thanks for having me.
How are you?
I'm doing well. How are you?
I'm good. Really good. Really happy to have you too.
Thank you.
So as you know, it's Sickle Cell Awareness Month. And I really wanted people to learn more about sickle cell, specifically what it's like being a young person living with a chronic illness. Before we kind of dwell deeper into that, I first would like to learn more about sickle cell. What is it? How do you get it? What is the standard treatment?
Okay, well, sickle cell anemia is a genetic blood disorder which affects the oxygen, the way the way the body oxygenates blood. So, sickle cell, again, it is genetic, so you can only get it from your parents who have the traits. Now, the percentage, I'm not going to get into all of that, but it's not every child is born with sickle cell. Some are born with just the trait, some are born with full-born disease, and others are not born with either.
Okay.
In my family, I was born with the full-blown disease. There are a few different type of genotypes. I was born with the more severe genotype of SS, and my brother has SC, which is just the trait.
Okay. So when you say how the body, or is it the blood was oxygen? Can you say that again?
It's how the body oxygenates the blood. So with regular blood cells that are regular blood cells are like a donut shape. Like that's how my doctor likes to explain it to me.
Okay.
And that donut is able to carry enough oxygen to oxygenate the whole body. Whereas sickle cells are crescent shaped and they don't have that ability to carry enough oxygen to the body.
Okay. So what happens as a result of that?
When that happens, it means that the cells are now able to become hard, and those sickle bits kind of stick together, and they can cause severe crises anywhere in the body that blood travels.
Okay, so if I'm hearing you right, you're saying that a healthy blood cell is like the shape of a donut,
yes,
and a cell that is a sickle cell is like half of that, like a crescent shape, right? Like the moon? Okay. And it sounds like the healthy cell is it has a fuller field to carry blood to different parts of the body versus the sickle cell has a smaller field. Exactly. And as a result of that, the cell itself can't travel as well, let alone carrying oxygen. And so when it's not traveling well, it gets stuck in certain areas with other like cells, and that causes pain or other health complications.
Yes, it can cause pain, organ damage, scarring of the tissue, anything you could think of, really.
Oh, wow. All right. And then you also said that it's genetic. So it comes from our parents, and that, so I guess does it come from two carriers, one carrier? How does it work?
So it generally comes from two carriers. If both of your parents have just the trait, you have a 1 in 4 chance of having a child with the full-blown disease. Okay. Whereas someone like me who has the full disease, all of my children, no matter if their father has the trait or the full-blown disease, will automatically have the trait. So doctors like to tell me, in likelihood, to find a spouse who doesn't have the trait at all. So my children only just get the trait, which I say only because the trait doesn't affect your life as much as the full-blown disease, should I say.
Okay. All right. So it kind of sounds like genetic testing is really important.
Very important. Yes.
And most people, they do genetic testing while they're pregnant, right?
Right.
Not during the dating phase.
It's very awkward to ask someone about their genetics during the dating phase, but yes.
So I could imagine how that can kind of complicate the dating process for you. Like, do you know your status? Have you been tested before? What is the appropriate time to ask that? And we'll delve into that, into the interview. But thank you for explaining that.
Sure. Also, I just want to note that it generally affects the African American community and the Hispanic community. So that's also plays a big factor into spouse or, picking your spouse, if that makes sense.
Okay, so now we kind of understand how we got here, right, with the genetic component. Now I'm kind of curious about your personal journey. So how old were you when you were diagnosed?
I was about, according to my mother, 9 months old.
Wow.
My diagnosis was a little different from the regular American diagnosis.
Okay.
I was born in Cameroon, so they weren't as familiar with the disease back home in Africa. And when my mother had me, she wasn't where she had the trait, nor was she where my father had the trait.
Wow.
So when I was born, I was already a premature baby, and I hadn't had any signs of sickle cell until around 9 months old. According to my mother, I actually died 2 times, and then they were able to revive me, but they weren't sure why I was, why my heart was stopping. They finally tested me, and they found that I had sickle cell once I was revived. So it was around 9 months old. Yeah.
Wow. So are the signs of pediatric sickle cell cardiac arrest? Potentially?
Potentially, but they believe, again, bad medical technology back then, they believe that I had a splenic reaction, which is common in infant sickle cell.
Okay.
So pain apparently may have swollen up, or I don't know, something happened, and they weren't able to treat the initial cause, which caused my heart to stop.
Wow. I can imagine what that was like for your mom.
My mom, very resilient. So she said that, and her belief in God first and foremost was something that helped her through it. But as soon as she learned of the illness, she made sure to do what she needed to do to get to a state or country like America to get the treatment that I needed. And I give her kudos for that, because she got me here at 11 months old.
Wow. A woman of action. Well, that's good. I'm happy that happened in that regard. So you were a baby when you were diagnosed. How old were you when you started to understand that you were different from other kids? And she had to explain sickle cell to you.
I want to say my earliest memory of it was probably around 5. And she sat me down because I wanted to do something with my cousins at the time. And I couldn't because, well, like I said, I couldn't. She just didn't want me to because she didn't want anything strenuous and me exert too much energy to have a crisis. Right. And she sat me down and said, no, you're going to have to sit this one out. And that's when I believe she broke it down to me, saying, you can't do as much strenuous activities as everybody else can because of your illness. Mm-hmm. I didn't quite get it at the time, but I did know that I had something wrong with me that would cause me to go to the hospital. I just didn't quite grasp the understanding of it. She just told me it was just an illness that I had to monitor and to try to avoid things that will put me in a situation of getting sick.
Okay. I mean, you were 5. So what can you really say? Do you remember how you felt when she explained that to you?
I definitely felt like a little outcastish. I wanted to be just as regular and normal as the rest of the kids. I wanted to, play basketball and run up and down and do track. And so I definitely felt more so left out. And that kind of probably turned me into the rebellious little kid I was, to try and sneak around and do it anyways, because a kid would, So I was definitely, I did definitely feel left out of a lot of things. Yeah.
I can imagine. And I can imagine that must have been really hard. You're just a young little girl, just wanting to play with her friends. And when you think about kids in general, kids don't want to be different from their friends.
Exactly.
Right? You want to be the same. You want to blend in. And if there's a situation that causes you to kind of stand out, most children don't deal well with that. So how did you deal with it?
Initially, as a kid, I didn't deal with it really well at all. I went through the whole bullying phase of, oh, your eyes are still yellow. And that was due to sickle cell. So if my eyes turn really jaundiced, it could mean multiple things, enough water. I'm getting sick, or honestly, it's just a regular Tuesday.
Okay.
So, getting picked on, getting called yellow eyes or lizard or whatever term you throw at me was really rough. And I got into a lot of fights. I did. Um, I don't know why I fought so much, but I did get into a lot of fights just to kind of prove that I was normal and I could stand up for myself. So, yeah, growing up in Texas was a little different.
Yeah, I can imagine how hard that was for you.
Yeah.
Especially because mentally that you're different, right? Something you're kind of holding to yourself, and to have that difference be reflected in your body and have everyone else know. And they're not at the age where they can understand any more than you can. That must have been really hard.
It was pretty difficult. Thinking back on it, I do wish I dealt with it a little better, but during the circumstances, I feel like it wasn't too bad.
Yeah, I mean, you did the best you could what you had.
Yeah.
And when we get older, we know better. But at that time, that was the best way for you to assert yourself, protect yourself.
Yes.
Yeah. So that actually is a segue into the next question I have for you. And that is your childhood experiences growing up. So we talked about you as a small child, but now as an older child, as an adolescent. What was that like, living with sickle cell and being a teenager?
Ooh, it was interesting because my adolescence going into my teenage years was a big change for me, from being like in middle school, knowing that I could miss gaps of school just because I was sick in the hospital, and having to still keep up with my schoolwork because my mother was not playing with it. No matter if I was sick or not, she was in there with my homework saying, no, wake up, let's do this.
Wow.
So I had a harder, how do you say, a harder time going through just school alone. Like, school itself is difficult. Going through school and then having to do school in the hospital with medications, and then coming back from being out to then explain to people, hey, I didn't just quit school, I was actually in the hospital. But it was very private, not wanting to actually admit that I was in the hospital. So trying to create stories in my head of like, oh, I went to go a month in Japan or wherever I decided I was traveling that day.
Oh, wow. Okay.
Very, I was bad. I would try and create my own fantasies to hide the truth, and I didn't want that pity look, or having to explain my downtimes to kids who I didn't think would understand. Then going into high school, leaving Texas, moving out of Texas, starting high school in a state like Baltimore, Maryland, it was already rough. So I had no friends. I'm in a whole new state. I don't know if people even know what sickle cell is, and that transition was actually difficult only because making friends, letting them know I had this illness. It was like, how do you start that? Like, how do you start that conversation?
Right. Yeah.
I get close to people who I then turned around to not understand my journey. If that makes sense. So high school, I think high school was actually better than middle school. Because at high school, you're able to exert your independence in a sense. So my friends, I kind of grew into my own being, letting them know, like, this is what I have. I have sickle cell anemia. I kind of go in the hospital here and there, and then people wanting to still reach out to me made me like, okay, this is not a taboo type illness. Like, people don't have to I don't have to hide my feelings from it. People actually are okay and understanding in a sense. And that's kind of how I grew to be able to kind of voice my own opinion. I mean, my story, should I say, with high school.
Okay, that's great. So I have a few follow-up questions. You mentioned you missed quite a bit of school. On average, how much school were you missing?
I would say in a given grade, I missed about 6 to 7 weeks of school total.
Wow. So how long would you be away on average? Like a couple of days, a couple of weeks?
On average, it actually depends on the flare up. So a normal flare up will keep me out of school for like 2 days, just monitoring at home, fluids, and an admission when I was admitted to the hospital will keep me out of school for like 3 weeks.
Wow.
Yeah.
Okay. For those who don't know, what is a flare up?
So what a flare up is generally just a pain attack. So for me, every sickle cell patient is different. My general flare ups would be in my chest and my back and in my joints. It would just be a sudden cause of just immense pain and intense pain in one area of my body that just takes my breath away, essentially. Especially when I was younger, it would just sneak up on me. And normally it happened at night, but sometimes it happened during the school day where I would look at my teacher and just kind of like freak out and saying to go to the nurse.
Oh my goodness. All right. So you mentioned that your mom would bring in your classwork at times.
Mm-hmm. Yes, my mom was very on it. Like I remember to the T that as soon as she heard that I was in pain or I was in the nurse's office, she not only did she get there, but she made sure every job she had was very flexible because she knew that she had to drop it and she had to be able to change her work schedule. So I thank her for that. But she made sure she was there at the school picking me up. Also telling my teacher I'll be back for her schoolwork every week. Just get it together and we're going to knock it out. She's not missing school. Because a lot of the teachers were very ready to just tell me, you can make it up next year. And and my mom's like, no, she's not repeating anything. She'll knock it out in the hospital. Like, we'll get it done. So yes, my mom was on it. Schoolwork. And sometimes my friends, they would try to help if they could.
That's nice. Do you think teachers would say that because they wanted you to just take the time for your health, or do you think they didn't want to be bothered?
A little bit of both, honestly. I feel like a lot of the teachers didn't want the split up of their courses. Like if they were going to continue with their class and they know that their class is going on a journey, they didn't want to have to come all the way back to catch me up as well because it was just me. So it will make it easier if they were just like, okay, just catch back up next year where we can all go through it again with another class. Whereas some genuinely just like want your health to be first.
Okay. So like, would you have independent calls with the teachers later on, or did you just solely do the work independently at the hospital?
I did it independently at the hospital. I was also very hard-headed in a sense of I can do it. I don't need help. Mm-hmm. So I made sure that I didn't need to lean on anybody if I didn't have to. I didn't want to be like a burden or, another issue that they had on their plate. So I knocked it out by myself. Well, with my mother's help when she could.
Mm-hmm. I think what you said was really powerful. A young child, and you were holding your condition, and you feel like a burden to other people.
Yes. It's interesting. Even now, as an adult, I still feel myself battling with that notion. But as a child in particular, I didn't want to be a burden. I didn't want to be a burden to my parents. So sometimes I wouldn't even tell them I was sick. I just go sneak and take my medicine because I knew what to take. And with friends, I couldn't go somewhere or I was sick. I would just be like, oh no, I can't. My mom says I can't come out tonight, or make an excuse because I didn't want to be like, okay, here she goes again. I didn't want to be that problematic person in people's lives.
So that was another way for you.
Yes.
Right. So it's like, okay, you have the sickle cell, you're dealing with it, but then you're still trying to not only protect yourself, because like you said, I don't want the sympathy or the empathy, I don't want the pity. And then, also it seems like you're trying to protect other people. Like, I don't want my parents to worry. I don't want to be a burden to them or bother them. So it sounds like you were juggling so many things at such a young age.
Definitely. And honestly, at the time, I didn't realize it. It took age and knowledge for me to really come to terms with what I was doing. I just thought it was more so just, I'm being strong, but no, it was because I didn't want to be a burden.
Yeah. Yeah. I think this will be a topic for another episode. The age that young Black women learn how to carry the weight of themselves and other people.
It's going to be a good talk.
Okay, so let's kind of fast forward to friends. So you mentioned when she reached high school, you took a different approach and you would be a little more forthcoming. Was that to kind of gauge the person's commitment to you as a friend, or you just wanted to be out in the open so you didn't have to revisit later? What was the motivation behind that?
It was honestly just to get it out in the open. I went into high school saying there's be a lot more upfront about a lot of things, like no more dancing around the issues. I wanted to just come out and let them know from jump, like, this is me, this is what I have. It doesn't define me, but it does interfere with who I am sometimes, but not as a friend. So like, I want to let them know I'm always going to be a friend, but some things I just can't do. And you hand it or you don't.
Okay.
Yeah.
I think that's very mature. I mean, just like putting on the table, like, this is the relationship I want to have with you, right? This friendship. And this is what I can do. This is what I can't do. So setting up those boundaries, that was very mature of you at a young age.
Thank you. I didn't see it as mature at the time. I just kind of was like, I have to try and protect myself because I was hurt by a few people, friend wise. So I knew that going into it, I had to just be upfront and you either handle it or you don't. And down the line, if I noticed that you couldn't handle it, that's fine too. I'm not going to hold it against you. This illness is not for everybody. Sometimes not even for me, but I am stuck with it, So I always wanted to give people essentially an out, if that makes sense.
Okay. Yeah, I think that was another mature sign too. Just not trying to hold on to relationships that weren't meant to be, and being okay with that, so to speak. I'm sure it wasn't so simple when you're young.
No, it wasn't. It definitely wasn't. Because I still would, certain people, they hung on for long enough to be attached. And then when I realized that they weren't there or they weren't able to be, letting them go was hard. So then I would try to, I won't tell you I'm sick. I'll just deal with it just to try and hold on. But you can't hold on to everybody.
Yeah, that's true. It's very true. So looking back, we didn't have the term coping skills then, like we do now. How did you handle everything? Because just listening to your story, I can hear you were carrying a lot of weight, juggling a lot of things, trying to meet the demands of your body in terms of your illness, but also in terms of your development as a young lady, right? And trying to meet school demands, relationship demands with friends, your parents, siblings. You were doing a lot. So you were being a normal girl in one capacity and then still trying to cope with something else in another capacity. So how did you handle that?
Oof. That's a good question. Like you said, coping wasn't the term back then. It was more so just deal with it, right?
Yeah.
I would say I had an escape in a sense. Growing up, I had an active imagination. I still do. I'm not gonna lie. It's the theater junkie in me, but I would escape into television, into writing, into music. Anything that wasn't my reality is how I cope. Like even when I'm in pain, still to this day, when I'm in pain, I know that distraction is the best method for me. So I would put on a movie and take myself completely out of it, either movie or music. Also, another big way I coped with it was hard to say, but it was eating. I did a lot of, I ate my feelings away, when I was in pain, I ate. Even if I didn't feel like eating, I forced something down. If I didn't want to talk about it, I ate. I wasn't big on crying or anything like that because I didn't want to show weakness. Growing up in a very African household, you don't really show weakness like that. So crying wasn't something I did unless I was in absolute pain. So since I couldn't really let myself cry, I would eat. Yeah. So I don't know if it was coping or deflection, but that's how I dealt with it a lot of the time.
So coping is any way we handle a situation, And I always say you want to look at the short term and long term effects of that coping skill to really gauge if that's the best thing for you. So eating at the time was a positive coping skill for you because it gave you that instant gratification. I don't want to talk about it. I want to feel better. Let me eat something that tastes good. Right. So for what you needed, it was able to give you that. But then it may have had long-term consequences, such as, excessive weight gain, which could have affected your self-esteem, for example, or could have even complicated health conditions. Right. So coping skills, they can be positive no matter how you look at them, depending on what you're going for. But I think one way to kind of gauge if it's good for you and what you need is to look at it long-term. Is this something that I can really carry with me? Or is it just something that will satisfy me in the moment?
And eating was definitely just in the moment because now I don't do that anymore. Now it's just strictly music, writing, acting, anything like that.
Something you said earlier about your imagination. I want to come back to that.
Okay.
Because one coping skill that's positive long-term is what we call visual imagery. And what that basically is you sitting in a place that's comfortable to you and going into your mind, imagining that you're somewhere else. Yep. Sometimes I do my patients, we imagine we're at the beach, in like a farm, something like really nice and quaint, or even something personal to them, like their parents' home, their childhood home, for example, or their favorite summer camp, things like that. And so the fact that you said that and you think it's silly is actually not. Our mind is so powerful and we can rely on it in that way, right? Just going into it, deep into it, kind of getting yourself out of reality for a minute, because sometimes we need a break.
Very true. Yes.
And you don't have to be on all the time, and it's exhausting and you do need to rest. And visual imagery is one of those ways. And so you imagine that you're somewhere else, and then you also incorporate deep breathing. So you're relaxing your body physically, emotionally, and mentally as well. So I think that's stuff that you're doing that because that's what it is.
I didn't even know that. That's pretty cool. Yeah, I would definitely take myself out of my actual settings. I was back in the 90s, I was in Fresh Prince of Bel-Air. I was the Fresh Princess or wherever I put myself, whatever show. And then I'd write it down and start to do that. So that took me out of it completely.
Yeah, I'm glad you had that. And then your art expression too. I think that's a common one people talk about now. So writing, music, song, I know that's music too, but the different aspects of it, those are all great, again, long-term coping skills.
Yeah.
Wonderful. Okay, great. So, all right. So you're a young girl. Were you dating as a teenager?
Yeah.
What was that like?
Dating was and is difficult. I'm not gonna lie. I will never forget my first actual boyfriend. Taught me a lot. And I say that because he kind of shaped how I go on dates when it comes to explaining my illness to people. Okay. And when I explain it. So I want to say, it was like 9th grade. And we actually went out to like a movie. And that's when we kind of became official. So dating was like, it was new and it was cute. But when I told him what I had, I just kind of left it at a blanket statement, like I have an illness. And I never really got deep into it. I didn't feel the need to explain. Just let him know I have an illness. Sometimes I can't do everything. And he was like, okay, that's cool. And then let's go to 3 months later when I actually am in the hospital and I'm admitted and I'm sick. And then he texts me like, hey, we want to meet up. Let's go to the movies. And I'm like, actually, I'm in the hospital. And his response was, okay. So I was like, okay, well, because he just understands. And then the next day, let's go out again. And I'm like, wait, I don't think maybe you didn't quite get it. I'm actually admitted in the hospital. I've been here for about 2 weeks. You didn't realize I was at school? Or he's like, I just thought you were out. Like, I didn't think it was serious. And that's when he was like, oh, wow. So this is something that you go through a lot. And that's when he kind of tried to understand it. And when I explained it to him deeper, he goes, I get it. I hope you feel better. And I didn't hear from him for another week. when I reached back out to him, he said, I'm going to come and visit you. And he actually came to the hospital to let me know that he can't handle this. Mm-hmm. So being dumped in the hospital during crisis taught me a lot about the dating regimen. And that was probably the relationship, or not a relationship, it was just like a thing. It didn't last long. But the one relationship interaction that taught me to talk to my spouses or my significant others about my illness from jump. Like, let them know, like, this is what it is. And if you're not familiar with it, it tells me a lot that they even go and research it, like, on their own without having me do the footwork for them. That makes it so much better, honestly.
Yeah. Well, I'm sorry to hear about that experience, but I'm happy to hear that it was a lesson learned and something you can apply in the future, just being more upfront. So it kind of sounds like you adopted that with friends, but not so much in relationships.
Exactly.
And so now you're kind of developing that as a general way of life.
Yep.
Okay, so let's kind of move into you as a young lady, an adult. How has that been growing into a woman with sickle cell? You know, when I think about school, like college, for example, what was your college experience like?
College was rough. College was the moment that you realize that you're an adult, but you're still a child, if that makes sense. Mm-hmm. So you're doing everything on your own, and you're trying to form this newfound independence, and you want to make sure you let your parents know, like, I am going in the right direction. But with sickle cell, I still had to be essentially dependent on my parents and friends. And that was hard because I wanted to be independent. I wanted to be like my other friends who were in the dorms and living the college campus, but I couldn't because of my illness. Knowing that, not even knowing, but believing that being on campus would somehow make it harder for me to go to the hospital if I needed to go because of parties or whatever was going on. That affected my thought process of even selecting a college. So I started out in community college just because I wanted to make sure that I still had a home front for when I needed to be admitted and I needed to get my schoolwork. I did a lot more online classes in college because I knew I couldn't always be there. So online courses were my thing. College was hard because taking a full course load of college work and being admitted to the hospital, knowing that I would sometimes miss classes or be too inebriated to finish a project, and having to reach out as my own person, not my mother, reaching out saying, hey, professor, I need an extension, or, and not trying to use it as an excuse. Like, they would, like a lot of professors were like, okay, you're sick. And now I have to show notes and big issues sometimes. So college was definitely a lot more difficult than I imagined it would be. Mm-hmm. But I got through it. I got through it.
How did you?
I got through it because of the support system I have, of my mother and my friends that I have around me. So I still took a full course load against my doctor's wishes. I also still worked 2 jobs against my doctor's wishes.
Wow.
And I just pushed through, honestly. I just had this tenacity of, I need to graduate. I want to get my bachelor's. I want to be done with school, but I don't want to take my time with it. I know a lot of patients that I talked to told me that they only took 2 courses at a time in college. It took them like 5 years to graduate, which is great because they stuck through it. But I knew that I did not want to be in college for that long. I wanted to be done with it. So it was definitely difficult, but I feel like my support system helped me get through it.
Okay. So let me take a look at my list of questions here. How did it affect you mentally? So I've heard you say throughout the conversation that it was hard and it was challenging, right? But I think those words kind of describe the situation, but it doesn't describe how you were feeling emotionally and mentally.
Mentally, at the time, I would say I was, you mean like during college, right?
At any time.
Anytime? Okay. So I would say I had a mental journey of a roller coaster, essentially, from going to, okay, everything's great. I'm not in any pain, but still always being fearful of not knowing when it would come on, and being slightly depressed about it, because who wants to sit there and constantly think, when am I going to get sick? Like, when is this going to explode and ruin my, what seems to be normal life, you know?
Mm-hmm.
But at the time, I didn't call it depression. I just was like, oh, I'm just a little sad. I didn't really understand depression or anything like that. But getting into my adult years, my 20s, like mid 20s, I would say I had the biggest battle with depression when I graduated college, actually. It was the night of my graduation week. It was a week of my graduation, should I say. And I found out that my final classes were on Thursday. My final classes were Friday. My final assignment was due. And I thought, look, I'm feeling great. I can go to a concert and celebrate with a friend of mine. Went to the weekend concert. And again, just thinking I can do this normal activity.
Mm-hmm.
And as that was over, I turned to my final project and I just thought to myself, I'm done. And the amount of joy that I felt, I can't even explain it. Like, I was so happy. I turned in my final paper. I might graduate with honors. And I went to sleep thinking, like, this is it. I'm done. My mom's going to be so proud, right? Just to wake up at 7 a.m. and not be able to move my body. I couldn't move my arms. I couldn't move my legs, both of them. So I freaked out. I'm living alone. My mom is 30 minutes away. Who do I call? I'm not gonna lie, I'm too cheap for an ambulance. That's the first thing that thought came in my head. Too cheap for an ambulance. I'm not calling that. So I used my nose, actually. Now, one of my friends who lives up the street, because I could not, lifting my hands hurt so bad. I couldn't even move my arms up in the air. I couldn't stand on my legs too long. I put my pants on by like kind of wiggling. It was the worst time. And one of my best friends lives 5 minutes up the street. He got here immediately and helped me down the stairs. And I just kept thinking to myself, I can't miss my graduation. Like, I'm graduating. I did this and walk across the stage. That was my goal.
Yeah.
And the overwhelming sad, I wasn't even sad because I was in pain. I was sad because I couldn't experience that one joy that everybody else gets to experience. Yeah. And that hurt me more than the actual crisis. So being in the hospital, trying to also front that I'm okay. Oh, it's just a graduation. But at the same time, internally being so disappointed.
Yeah.
And my friend called me like, oh my gosh, girl, they called your name. You actually got honors. And I'm like, oh, he held the phone up to I could hear my name. And it was great, but it wasn't what I wanted. So that was probably the most depressing time I've ever felt. And came to the realization that sickle cell is just a battle that I thought I was prepared for, but still knocked me off my feet.
Yeah.
So yeah, that mental state for me was really rough. And then to find out that I had sickle cell caused a new issue, that I was my bone at the time was, they call it osteonecrosis, essentially, where the blood flow stopped and my bone narrowed and my bone was becoming weak, and it was actually breaking on my left leg. And
wow.
Only that I missed my graduation, I had to stay off my leg for 3 months, and I'm out of work for 3 months. Well, I have a job. All of this is going on in my head in the hospital, and then you're in the hospital by yourself. No one's spending the night with me. No one's constantly there to make sure my mind isn't racing. So it's the mental battle alone was like, it was brutal. Like, I can't even really say anything else but brutal, because I thought this time I never shared it with my mother. Honestly, it's my first time sharing it out loud, because I didn't want my mom to even think that, oh my gosh, she's in a place of depression like that. I didn't want her to think, I wasn't trying to end my life or anything like that, but I was still internally sad. And she did everything she could to make me happy. I mean, she brought a cap and gown in the hospital. She played the graduation music. I had friends coming with graduation balloons, but it still wasn't the same as walking across the stage, you know? So that was the biggest adulthood depression that I felt in a long None. Yeah.
I need a minute.
Okay. You okay?
I could hear the emotion in your voice. That was your moment. And I can only imagine the devastation you felt.
Yeah.
And the helplessness you may have felt.
Yeah. That's new for me. I don't like depending on people, unless I have to. It's not me.
And it puts you in that position to always need someone. And it's not necessarily a bad thing. We are social by design, and we are meant to be connected with people and need people. But there's also value in being independent and knowing you did something for you. And to know that that is something you may not always have when you want to have it. I'm sure, I don't even know if I can put into words what that is for you. But just hearing that and just remembering when I graduated and how I felt. And I didn't have high honors, so see you. But just knowing how I felt that accomplishment, and the excitement of the day, and that was taken from you. It hurts to hear, and I can only imagine what that feels like. Yeah. So, okay, let me go back to my question. So, unfortunately, this is a battle that you have to continue to fight for the rest of your life. So, with that, how do you navigate with that awareness? How do you maintain your wellness?
I would say knowing that this is my forever battle. Well, I'm not going to say forever. I'm praying that there's a cure soon. There's cures, but I want a cure, So I make sure that I take my medication. That's a big thing. My alarm goes off daily at a certain time to remind me to take my medication, because I've seen that on the medication, I'm doing a lot better, less flare-ups. I went from 3 admissions in a year to 1 admission in a year. Sometimes none. So I know that the medication is helping. And also keeping up with my doctor's appointments and being honest with my doctor. I love the rapport I have with my doctor. I talk to them like they're my friends, and they talk to me just the same. So knowing that my doctor pull me up and say, I know you're not playing games right now, and holding me accountable and have serious conversations with me. Also, keeping up with any type of clinical trials. I like to make sure I know what's going on in the sickle cell world. Like, what are the new drugs they're trying? Am I a candidate, honestly? And just keeping a journal of the changes of the disease as I get older. Because I was told as I get older, the disease does become a little bit more, even though I've had some issues, it becomes worse, which is kind of scary. So just noting the things that are happening, the new pains and sensations I'm feeling, and making sure I find a plan to alleviate it immediately. Also, just trying to get back into the run, eating better, exercising more, and keeping my mental awareness up, if that makes sense. So reading more and teaching myself new skills that I don't know. Like, I just finished getting a certification as a Scrum Master. Just things like that. Trying to keep my mind as alert as possible.
Yeah. Okay, thank you. So I'm going to repeat back what I heard. One way is just kind of being aware of what's happening right? So you stay up on clinical trials, which I think is phenomenal. Another episode will be research within the Black community. So you're giving me a lot of content, but keeping up with that, seeing if you're a candidate. Most people don't know that when you participate in a clinical trial, you get the best healthcare.
Yes.
They literally monitor you, any type of bing, bang, pain, anything. They're checking on it, working on it. So that is one way to consider it, right? But also, again, this is furthering science. So you're contributing to something that you will benefit from, or someone you care about will benefit from. Okay. Staying on top of your medication. That's key. That's key. I'm really happy to hear that it's working well for you. So happy to hear that things are getting better. Slowly but surely.
Yes.
Being honest with your doctor. Yes. I wanted to jump up when he said it, because like you said, that relationship, this is the person who's here for you, and they sound really supportive too, which I think is phenomenal. Yeah. So it sounds like they've created a space where you feel comfortable to be honest. You know what? I've been binging on junk food all last week. And they're like, okay. So how do we get back on the train, right? And they also said reading, writing, doing things you love. Those things can fill us up so much. It's a healthy distraction. And then it gives us something too, right? So those are phenomenal. Great. Okay. So earlier in the interview, you mentioned that you are a transition mentor, counselor. Okay. Can you explain that in a little more detail?
So being a transition mentor, well, I'm going to start with transition. A lot of people don't know that in the hospital, as soon as you turn, some hospitals, I know in Maryland, as soon as you turn 22, you are no longer considered a pediatric patient. You are now an adult. And with sickle cell, because it affects the Black community, when you become an adult and you leave the pediatric side, you're literally leaving the joy, butterflies, color, niceness, friendly attitude of the pediatric center to come to the adult side where it's stigmas and judgments and gray walls and just not a friendly environment. Mm-hmm. So me going through my transition period without a mentor was rough. I turned 22 on my birthday. I was in the hospital. I had a crisis immediately. So I didn't even get to transition properly. I just was thrown into the adult side. And the judgment that they give you in the ER, that you're seeking drugs, that you're not really in pain, you're just trying to get some opioids, get a little fix. That stigma alone almost killed me, to be frank. Wow. I went in with chest pain and I told them I had sickle cell, and they looked at me like, okay, what's your pain level? And I said 10. I'm crying, I'm in tears. And they're like, is it really 10? It really went like that, just 10. And I'm like, I don't know what the quotes mean, but yes, it's a 10. And she said, okay, what's your drug of choice? Do you want Dilaudid or more? And I'm like, well, Dilaudid gives me a bad effect, so I know I'm both morphine. And she just smirked and walked away. If my voice wasn't as strong as it was, I probably wouldn't have done any care, because she never came back. I had to get back up in pain and hound the nurse at the time, the nurse attending at the time, and say, I need to get checked in. I'm in pain. I called my mother. I called my actual hematologist and anybody on call. Yeah. Luckily, the on-call doctor called in and we got things rolling, and my mother was already on her way. When I finally got back, I just remember not being able to breathe, and I passed out. I don't really remember how everything else unfolded. I just know I passed out. I woke up to a central line in my neck and a big vacuum mask on my face, helping me breathe. And my mom in my face telling me to calm down. And my immediate reaction, because I'm stubborn, is to pull everything out. I don't know what anything is, so I'm trying to rip it. So they restrained me and sedated me. But all of that happened on my first visit to the adult side. So I was like, that can't be everybody's story. That really can't. So I went to my doctors, and they created a program at Hopkins for transition mentors to help transition the youth from the pediatric side to the adult side, which means that I would go in and help them set up that first appointment with their adult doctor, show them the floor that Hopkins actually created just for the sickle cell side. So in the emergency room, they have a trained unit now for sickle cell patients. We are at the top of the list. As soon as you come in there and say you have pain, you go to the EACU, which is the unit, and it's no waiting, it's no extra judgments, no, are you sure? It's, we got you. And I get to show them that area, let them know like, hey, it's no more, it's still stigmas, but we're trying to alleviate it and walk them through what they should ask for, what they should say. As soon as you check in, you have sickle cell anemia and your pain level. That's it. There's no extra, what's your drug of choice? There's no extra in-betweens or judgments. We get to go. So that was very important to me. So I was able to transition to adult, and she, not a lot of people sign up for it, you know. Black, us as Black people have a hard time accepting help, but I was able to help us do, which was really great. And I showed the women just the transition of it, the adult side of the hospital, and also the adult sickle cell clinic, which is also in Hopkins, which is great. So in the daytime, if you're sick, you can go to the clinic and they can treat you. If you're still in pain, you can alleviate all the extra stuff and go to the admission. So yeah.
Wow. Okay. So 2 reactions. One, I can't believe that nurse, provider, whomever said that to you. Well, I believe it, but then I can't believe it because that was very unprofessional. And I'm sorry you had to experience that. So what are the stigmas associated with sickle cell?
The biggest stigma is that we are all just seeking drugs and the pain is not real. Honestly, it's that we're addicts, essentially, who want to go to the hospital and lie and say we're in pain just to get some morphine or some Dilaudid. And that's not true. Our pain can't be seen. It can't be tested for. But it doesn't mean we're lying. Now, I'm not saying that there aren't drug users who might do that, but not every sickle cell patient you meet is a drug seeker.
Mm-hmm.
Another stigma is that, excuse me, is that we, sorry, makes me a little mad. But another stigma is that we're liars, essentially. Like, we always say we're at 10, or we're always in an outrageous amount of pain. Like, I've had doctors tell me it's not as bad as you can stop crying. You know, I've had that. And that stigma is, you can't tell someone how to react to pain or how not. So when I come in the hospital, sometimes I'm trying to practice my breathing. Have a breathe like this, I'm not crying. And I tell them I'm in a pain of a 10 and they're looking at me like, but you're not crying. So that you're clearly lying. You're not at a 10, you're at like a 7, but you want to be a 10. No, I just know how to focus my breathing. I know that crying makes the pain worse. If I cry and the pain gets worse, I can't advocate for myself. So I know how to not cry. It doesn't mean I'm not in pain. Unfortunately, the fact that I have been able to cope and work through and function through a pain of a 10 does not make me a liar. It just makes me, unfortunately, someone who's had to deal with that.
Yeah.
Yeah. And another stigma for sickle cell patients that I just realized is that people believe that there's a cure out there and that the people with sickle cell just don't want to take it. When the fact of the matter is the cure is not a cure for everyone. I get a lot of emails, clips in my inbox of, this person in Chicago was just cured yesterday. Why do you still have it? And I'm just like, you read the article. You probably read that they had a bone marrow transplant, which requires a donor, which requires matching, which requires percentages. And a lot of the times, you have to have a sibling, not a step sibling, an actual sibling that's higher than about 80%. Now, we've gotten tested. My older brother is not a match for me. So unfortunately, I can't get his bone marrow. So I can't go that route. But also, people who have gone that route, who have matched, it's not 100% cure. I know patients at Hopkins now who, out of the 3 people that went through it, only one's cured from it, and 2 are not. But they spent 6 months in the hospital going through chemotherapy to, I guess, kind of negate blood and switch out their blood and get the bone marrow, all to realize that it's sickle cell. It's a flip of a coin. And unfortunately, not everybody's going to do that, even if they have. So It's not that we don't want to, we're not trying to get cured. It's that the cure isn't 100% guaranteed. And it's not something that everyone's qualified for.
Yeah. Okay. T, you're giving me a lot of content. Another episode of Racism in Healthcare. So I'm wondering, you probably don't have an answer to this. It's just my thought process. I wonder if those stigmas are because sickle cell is more associated with the African American community. And so they just kind of transfer the stereotypes of the community onto the conditions that are more prevalent in the community.
Exactly.
I wonder, again, I guess it's another transfer because people who are more fluent with the healthcare know that some of the stereotypes have been coming out or inadequate training. And one of them being that Black people have a higher level of pain tolerance or have thicker skin, which is not true, right? And another one, the drug thing. And it's like really confusing to me because were they not trained in sickle cell to know that it's associated with the crises and the pain and the inflammation?
Honestly, I remember asking one of the nurses because she came to take me on a walk because, you're admitted, they want you to walk, make sure your joints still work or whatever that is. And she was walking with me. She said, "Why are you here?" I said, "I have sickle cell anemia." And she literally looked at me and said, "Huh?" And I'm like, "What do you mean, huh? You're a nurse. This is like disease 101. You should know this." And she was like, "I don't remember reading about this." And another nurse was like, "Oh, it was a very brief chapter." And he just kind of went like that. I'm just like, "Oh, okay." But I also have a friend who's a nursing student who, when she was going through the nursing program, was like calling me like, "Girl, did you know that if you go to the ER, as soon as you say you have sickle cell, you're supposed to jump to the top of the list. And as soon as you say you have a pain out of 10, you're supposed to be the first to be triaged." I'm like, so it's in medical books, it's in your teachings, but does some courses just kind of skim past it? And she was like, "Yeah, my professor honestly just skimmed past it. I'm the one who took the time out to read about it because I know you have it and I know a lot of people of color have it. So I took the time to read about it." So it's honestly something that I believe is just skimmed past in the medical community, unless you become a hematologist or have someone that's affected by it and you want to learn about it. So me having to teach a nurse like, "Yeah, this is what sickle cell is," was really like eye-opening.
Right, and concerning.
Okay, she wasn't on my case much longer.
Okay, so second reaction. The mentorship program sounds phenomenal. Phenomenal. So thank you for being a part of that. I have a relative with not sickle cell, but another chronic health condition. And I remember his journey of being in pediatric until he was in his early 20s. And he was like, it's a completely different experience. And it's just like they kind of kick you out.
Yep.
Or unless you have a doctor who can pull some strings and keep you there a little bit longer, but eventually you have to go.
Gotta go, yeah. I cried on my 22nd birthday. I was like, "Oh my gosh, it's real."
Right. And it really warms my heart to know that you took your experience and you wanted to protect other people. And that seems to be a theme in the life story that you shared today about wanting to protect other people. But this was so impactful. And yes, you only have 2 now, but those are 2 people you saved, and there'll be more. Again, slowly but surely.
Definitely.
They'll come. And I think with more positive reviews and maybe more doctors knowing about it will help too. But the fact that there's actually a floor just for sickle cell patients, that really concerns me that the front desk don't know about that, or they don't understand the urgency.
Right.
But in all seriousness, the highs and the lows of your journey, they really take my breath away. And I really want to thank you for sharing your story, especially the difficult, challenging parts of it. Because like you said, it doesn't confine you, but it does define you. And I'm messing up. It's what makes you so beautiful. And it's what makes your story so beautiful. And so I just want to thank you for joining us today on Reflections in Color and talking about your journey. And before we close out, I just want to know, what are the next steps for you within sickle cell and within general life?
Well, let's see. In general life, honestly, my next steps are just to continue to create. I am in a frame of mind right now to do things that scare me. I've been trying to create content and put stuff out there that I normally wouldn't. So that's where I'm in creative life. I'm also trying to audition more, and I'm also writing a book. So that's just a few more things that I'm trying to do in my own personal life. As far as my sickle cell journey, I want to continue to just advocate and get the awareness out there. I feel like the month of September is a great starting point just because it's our awareness month, but I wanted to continue throughout the year, just getting voices heard and helping any way I can, honestly, whether it's walks or discussions like this, platforms like this, I'm so grateful for. And just trying to continue to keep it in people's minds and thoughts and get a better understanding out there for it, honestly.
Okay. Okay. Sounds amazing. I look forward to the book. Thank you again for joining. Thank you again for sharing your story. Thank you for your time. Thank you for your service. So much gratitude is extended on my behalf to you. Thank you.
Thank you so much. I really appreciate it. Thank you.